If you are receiving Social Security, SSI, or SSDI right now, I need you to pay close attention to what I am about to cover. There are three specific financial developments happening right now, in June 2026, that directly affect how much money lands in your account this summer and potentially for years to come. One of them puts cash back in your pocket this month if you act before the window closes. One could add significantly to your monthly check starting January 2027. And one involves benefits that are already sitting inside your existing Medicare coverage that a surprising number of people are not using. Money that is already allocated to you that simply expires if you do not claim it. I went through every federal update, every SSA announcement, and every Medicare regulatory change that has come out in the last 30 days. These three things are real. They are happening right now, and they are the ones most people on fixed incomes have not heard about yet. I will tell you exactly what each one is, who qualifies, and the one specific step to take for each. Stay with me until number 3, because that one requires 0 applications, 0 phone calls, and the money is already inside a plan you are probably already paying for. Before we get into it, subscribe to this channel right now and turn on the bell. Benefits change, programs open and close, and application windows disappear without warning. The people subscribed here find out in time to act. The ones who are not subscribed tend to find out after the funding is already gone. Subscribe now, and let's get into it. Surprise number 1, free money for your summer utility bills. If you are on a fixed income right now and your electric bill has been climbing every month, I want you to hear this clearly. There is a federal program that will pay your utility company directly on your behalf. Not a discount applied to your bill, not a coupon you redeem at the end of the month. An actual payment sent from a government program straight to your gas or electric provider, so that charge simply does not appear on your statement. The program is called LIHEAP, the Low Income Home Energy Assistance Program. Most people have heard of it in the context of winter heating bills. What far fewer people know is that LIHEAP has a summer cooling component that opens every year specifically to help households manage air conditioning costs during the hottest months. And in 2026, that summer window is opening right now across dozens of states. Energy costs this summer are not modest. Electricity rates in many parts of the country are up over 12% compared to last year. For seniors living alone on Social Security, running air conditioning through July and August can mean electric bills of $150, $200, even $300 or more per month. LIHEAP exists specifically to address this, and in most states, households where someone is 60 or older receive priority access. That means seniors can apply before the general public in many states, which matters significantly because this program is first come, first served. When the funding for your state runs out, the program closes for the season. There is no wait list. There is no second round. Once it is gone until next year. Income limits vary by state, but generally households at or below 150% of the federal poverty level, roughly $22,000 a year for a single person, qualify. Many seniors living alone on Social Security fall under this threshold without realizing it. The action step here is immediate. Do not wait until next week. Dial 211, that is the National Social Services line available in every single state, and tell them you want to apply for LIHEAP Summer Cooling Assistance. They will connect you directly to the office in your area and tell you whether your state's window is currently open. You can also search your state name plus LIHEAP Cooling 2026 to find your state's application portal directly. If you are in a state where the window is already open, apply today. The earlier you get your application in, the better your chance of receiving assistance before the funding is exhausted. Surprise number 2. Your 2027 Social Security check may be much larger than expected. Every October, the Social Security Administration officially announces the Cost of Living Adjustment, the COLA, which determines how much benefits will increase in January of the following year. For 2026, the COLA was 2.5%, adding roughly $50 to the average monthly check. For 2027, analysts had been projecting something similar, another modest increase in the low 2% range. Then the inflation data for April 2026 was released, and the projections changed significantly. The Senior Citizens League, a nonpartisan organization that tracks Social Security policy and monitors inflation data monthly, revised its 2027 COLA forecast upward to approximately 3.9%. Independent analysts tracking the same data have issued projections ranging from 3.8% to over 4%. The driver behind these revised forecasts is a combination of rising energy prices, supply chain pressures, and consumer price index readings that have come in higher than expected for 3 consecutive months. What does a 3.9% COLA mean in real dollars for the average recipient? The current average monthly Social Security retirement benefit is approximately $1,976. A 3.9% increase would bring that to roughly $2,053, an increase of about $77 per month. On an annual basis, that is nearly $924 more per year landing in your account starting January 2027. There are two important things to understand about this number. First, this is a forecast, not a confirmed figure. The official COLA announcement does not happen until October 2026. The actual calculation uses inflation data from July, August, and September specifically. The current projections are based on April and May data, and will continue to be revised as new numbers come in each month. If you want to follow the forecast in real time, the Senior Citizens League updates its projection monthly at seniorsleague.org. Second, when Social Security benefits go up, Medicare Part B premiums tend to go up as well, and those premiums come directly out of your check before you ever see it. In 2026, the COLA added roughly $50, but the Part B premium increase took back approximately $17 of that, leaving a net gain of around $33 for most recipients. A larger 2027 COLA would still result in a meaningful net increase. But understanding that Medicare costs typically rise alongside benefits helps you plan realistically rather than being surprised when your January 2027 check arrives. The next key date to watch is the middle of this month, when May 2026 inflation data is released. That will give analysts another significant data point and will likely result in another forecast update. Watch for that number and check the Senior Citizens League website for their updated projection. Surprise number 3. Medicare benefits. Already in your plan that are going unused. This last one is different from the first two because it does not require a phone call to a government office, an application, or a waiting period. It requires you to check something that is almost certainly already available inside the Medicare coverage you are currently paying for. 3 specific Medicare benefits that took effect or were significantly expanded in 2025 and 2026 are being used by a fraction of the people who are entitled to them. The first is the insulin cost cap. If you have Medicare Part D drug coverage and you use insulin, any brand, any dosage, any form, the maximum you should ever pay is $35 per month. No deductible applies to this cap. It does not matter which Part D plan you are on. The $35 ceiling is federal law and applies across every Medicare Part D plan in the country, and yet a significant number of Medicare recipients with diabetes are still paying more than $35 for insulin every single month. Either because they do not know the cap exists, or because their pharmacy is applying a charge incorrectly. If you have been paying more than $35 per month for insulin under Medicare Part D, call your plan's member services number and ask why. Providers are not permitted to charge more. If the charge has been applied incorrectly, you are entitled to a refund of the excess amount. The second is vaccine coverage. Under Medicare Part D, all vaccines recommended by the Advisory Committee on Immunization Practices are covered at zero cost to you. No copay, no coinsurance, no deductible. This includes the shingles vaccine, which has a retail price of over $200 per dose without coverage, the pneumonia vaccine, the RSV vaccine, and others. Summer is actually one of the best times to schedule these because physician offices have more availability than during the fall flu season rush. If you have not received your recommended vaccines, call your doctor's office this week and schedule them. They cost you nothing under your existing Part D coverage. The third is the annual out-of-pocket drug spending cap. Beginning in 2025 and fully in effect for 2026, Medicare Part D now includes a hard cap of $2,000 on covered prescription drug costs per calendar year. Once your out-of-pocket spending on covered medications reaches $2,000 in a calendar year, you pay nothing for covered prescriptions for the remainder of that year. This eliminated what was previously called the coverage gap, the period where seniors suddenly found themselves paying full price for medications mid-year without warning. If you or someone you know takes multiple medications or any high-cost prescriptions, track your Part D out-of-pocket spending. Once you cross $2,000, your covered medications become free for the rest of the year. 3 financial surprises. 3 action steps. LIHEAP Summer Cooling Assistance is open right now in multiple states and closes when funding runs out. Dial 211 today to find your state's application window before it closes. Do not wait. The 2027 Social Security COLA forecast has jumped to between 3.8% and 4% based on recent inflation data, which would add $75 or more per month to the average check starting January 2027. Watch for updated projections as new inflation data comes in each month. And Medicare Part D already covers insulin at a maximum of $35 per month, all recommended vaccines at zero cost, and caps your annual covered drug spending at $2,000. Benefits that are available right now inside coverage you are already paying for and that a significant number of enrollees are not taking full advantage of. None of these require complicated processes. Each one requires a single action taken at the right time. Subscribe to this channel and share this video with someone you know who is on Social Security or Medicare. Benefits this significant deserve to reach every person who is entitled to them. I will see you in the next one.